Okay. It looks like people are slowly trickling in from the waiting room. So we will give it just a few more minutes and then I will turn it over to you. Of course, just a reminder that we may be a little light on the Medicaid and MCO side as we had our provider forums today.
Okay. I believe I hear a new little person in your background.
You do, and I'm going to pre-apologize. My help that was supposed to come today has not shown up. So I'm hoping he's going to fall asleep. I think he's trying to fight a nap. So hopefully he'll fall asleep.
I think this is definitely a group that would understand that. So.
Hi, this is Kelly. I just wanted to let you all know I just admitted Alicia from the waiting room.
Okay, thank you.
Okay, Donna, it is 1 after 2. So if you want to go ahead and start as people are signing in, I believe you do. You should have a quorum. It looks like you have 3 of the 5.
Okay. Okay. Yeah, I'm just trying to see everybody's faces quickly.
And I do want to give a friendly reminder. We've been doing this for all the TACs that all voting members must be on camera. And also too, if you have questions, to try to raise your hand. We've had some issues in some meetings with people talking over top of each other, and the court reporter has a hard time capturing everything that is said. So I will turn it over to you.
Okay, thank you. Welcome to the Child Health Technical Advisory Group meeting. I think there are 3 of our members here, and hopefully our other 2 members may be joining us, and we have a special guest today. And Alicia, when it gets to that part of the meeting, would you please introduce our guest? Also, I believe, and Erin can correct me, Erin is back. And I believe that we like to have those non-members just put their names and affiliations in the chat box. Correct, Erin?
Yes, ma'am. That's what you guys like to do so that you know who's there.
Okay. So if you all could do that, I would appreciate it. I apologize for my Kentucky spring voice. Things are blooming and my voice is not. So I apologize for that. We do have a quorum. So we can vote on the minutes from the March 8th meeting. But we'll need a motion and a second to approve those minutes.
I move that we approve the minutes from the last meeting.
Okay.
I'll second.
Okay. And all in favor? Okay, perfect. Okay, so the minutes are approved. Old business, that brings us to the part of our meeting with our special guest speaker. So thank you so much for being here to educate us on this very important topic. And Alicia, I will turn it over to you so that you may introduce our guest.
Thank you. So we have with us today Adrienne Bush, and she is the executive director of the Homeless and Housing Coalition of Kentucky. And I asked her if she would be willing to come talk to the group just a little bit about the landscape of what's going on with youth homelessness in Kentucky, and hopefully give us some ideas of maybe things that this TAC could be working on to address that issue. So I will turn it over to Adrienne, and thanks so much for being here.
Thank you. Thank you, Alicia, for inviting me. I do have I have a PowerPoint. Is that okay if I share it?
I made you a co-host. You should be able to share your screen.
Okay.
And if you don't mind, if I drop my email in the chat, do you mind to email that to me so I can share it
Yes.
with the TAC members? Thank you.
Yeah, I planned on doing that right after the meeting. All right, so we'll go ahead and get started. Here's a little bit about the Homeless and Housing Coalition of Kentucky. We're a statewide nonpartisan advocacy organization. We have a pretty unique perspective on administering housing assistance to people experiencing homelessness. And our mission is to eliminate the threat of homelessness and fulfill the promise of affordable housing. Additionally, we do convene and staff the Kentucky Interagency Council on Homelessness. This is the statewide homeless policy and planning body that's authorized by Kentucky statute. We abide by the principles that A, housing is a human right, and housing is what solves homelessness. So here's the thing, homelessness is fundamentally a housing problem. And you're like, okay, then why are you here at the children's TAC as attached to the MAC? And that is because there are some supports that we believe Medicaid could provide for this population. We'll get into that. But I also think it's helpful to examine why we are here, why people are talking about housing, why we do have homelessness. And there are a few issues on the left-hand side of the screen. One is that unlike programs like Medicaid, housing or homeless assistance is not yet funded as the human right it is. It's not an entitlement. Nationally, 1 in 4 families who would qualify income-wise for housing choice voucher or public housing assistance actually receives it because of funding constraints on the non-defense discretionary side of the federal budget. Housing is definitely viewed as a commodity and a wealth building instrument. And that's, wealth building is great. We support that. But it is a constraint on when housing does not work for certain populations. We have witnessed continued defunding of mainstream housing assistance in real dollar value since the 1970s. And we also continue to see a mismatch between what housing costs and what people actually make in terms of income. That has really become apparent over the past few years as rents have really skyrocketed across the country and here in Kentucky. Policies around mental illness and incarceration contribute to the issue. And then we have longstanding patterns of race and class segregation that really have to be dismantled in order for housing to work for everyone. So all of these things, part of a large system that end up resulting in about 4,000 Kentuckians experiencing homelessness on a given night in January every year. It results in a shortage of 89,000 affordable homes to rent for extremely low-income Kentuckians. It results in an average wage required to affordably rent a 2-bedroom home being $16.18 an hour, while we've had upward pressure over the past few years. Really great. Don't want to complain about that. Still haven't quite caught up with what housing actually costs. We know that 1 in 4 Kentuckians are paying more than 30% of their income toward housing. That includes people with mortgages, and it really includes extremely low income renters who are paying more than half of their income on housing. And then we have a significant difference in the rate of home ownership in Kentucky among Black Kentuckians and white Kentuckians. Our Black home ownership rate is less than 40%, and the overall home ownership rate in Kentucky is over 70%, at about 72.5% actually. Okay, so when we're talking about homelessness, one of the methods that we use in this country is called the point-in-time count, and that is the total homeless on a street or a shelter or in a parking garage or a riverbank or up in a holler at a given point, usually in January of each year. In Kentucky, we have 3 jurisdictions. They're known as the continuum of care jurisdictions. One is Louisville, one is Lexington, and then the other 118 counties comprise the balance of state. So sometimes I get questions about, like, where do people experience homelessness? sometimes there is an observation or a thought that it really only occurs in Lexington and Louisville and in certain places in northern Kentucky. You can see from this pie chart that over half of the people counted in the January 2023 PIT count were in those other 118 counties. A little over a quarter, 30%, were in Louisville, about 18% were in Lexington. Go back. Okay. So digging a little deeper into this count from January 2023, we're going to look at Louisville's numbers. And this count was conducted by the Coalition for the Homeless. They are the lead agency for the continuum of care there, using the statewide homeless management information system that all HUD-funded providers have to enter information into about the people that they're serving. And so what we found in Louisville was that of those 1,338 people, 197 were children and families. That we have, not surprisingly, significant racial disparities within the homeless population at large, but especially within households that have adults and children. Of those households and the people, the adults and the children that were in them, 198 identified as Black or African American and 83 identified as white. And we know that that is disproportionate to what the general population in Kentucky looks like, significantly. In this count, there were only 7 households that were children only or unaccompanied youth. So just wanted to throw that out there because we are talking about youth homelessness. Some of the criticisms of the point in time count methodology are that it's an undercount, it's only a snapshot, it doesn't, because it's not a cumulative count over a year, you're not receiving the full picture. And that is true. The other piece of it too is that when you are doing a count of people, like think of the decennial census, where do we count people? We count people where they live. And if you are displaced or don't have a home, it becomes harder to count you, right? So, but what is helpful as a tool is just looking at it year over year. And so at HHCK, we tend to look at the trend lines. Basically, Kentucky's population from about 2013 on has been kind of, it's been decreasing at a moderate pace. And then it took a sharp turn up in 2021, 22, and 23. Another method that we use to help examine the problem of child and youth homelessness is the statewide homeless student count that is conducted within the auspices of the Kentucky Department of Education. So this includes state-funded pre-K through 12th grade, and it's done at the county or the school district, independent school district level, right? So these are the past few school years. You can see that we had about 21,000 students identifying as homeless. And so you may say, Adrian, that is significantly different from the numbers you just shared about the point in time count. That's because schools use a different definition. They use a broader definition that includes people who are street and shelter homeless, but it also includes children who are couch surfing or their families are couch surfing, as well as living in significantly substandard housing. They may have a house to live in, but it may not have running water. The electricity may be off half the time, and it may be like 200 years old and no insulation, right? So for example, going back to Jefferson County, they counted about 3,500 students experiencing homelessness in the last full school year. some additional context for homeless and unaccompanied youth. So again, if there's one takeaway I would like you to have from this presentation, is that homelessness is fundamentally a housing problem. So of course it's the housing, but with youth homelessness, there are some additional factors that complicate things. Number one is family conflict, and that may manifest itself because of basically the rest of this list. Pregnant and parenting youth, teens who identify as LGBTQ, according to True Colors United, which is a national group, are 120% more likely to experience homelessness than their straight peers. Involvement in the child welfare system, involvement in the juvenile justice system, and then intersection of race with all of these systems, which then ends up resulting in racial disparities. So every year, the Department of Housing and Urban Development has to put together a report they call AHAR. It's a great name. They really need to rebrand it. They presented to Congress to talk about the state of homelessness and where it's increasing, where it's dropping, that sort of thing. And what they found from the 2020 AHAR was that the number of homeless youth dropped by 12%, with a 32.8% drop in the number of unsheltered youth under 18, and a 21.9% drop among those unsheltered aged 18 to 25, those we would call like transition age youth, right? And that's because the federal government put some very specific targeted resources to try to solve this issue. One was the Family Unification Program, which we do have those vouchers available in Kentucky, which I'll talk about. And then another is called Foster Youth to Independence vouchers. And then we also have 2 areas in Kentucky that have current youth homeless demonstration programs in Jefferson County and southeastern Kentucky. So a few years back, HUD released a notice of funding availability nationwide. And so communities, continuum of care jurisdictions could apply for this YHCP funding. And so Louisville was successful in securing some of that funding, as well as about 8 counties in southeastern Kentucky. And so they were able to set up projects, fund projects that would address this need for housing and supports for youth experiencing homelessness. We also have a few selected specialized providers. Arbor Youth in Lexington is pretty well known, Brighton Center in Northern Kentucky. Mountain Comprehensive Care Center has a specific program in Moorhead for this population. Part of the issue with housing and why it's so difficult is that it is very based on local conditions and local resources. You have the federal government, and then you have some cities who are able to put money into housing and homelessness, but your mileage may vary based on where you live. But one piece that is across the board, going back to the KD school homeless count, every school district in Kentucky does have a designated McKinney-Vento liaison. So every school district has an employee whose job it is to both identify and provide services for children experiencing homelessness in the school system. Here, your mileage may vary as well, just because some school districts are better resourced or are able to put together other non-federal funding to put together a more comprehensive program. We do have a state-funded homelessness prevention project for youth exiting foster care. There are a couple of other target populations. One is people exiting prison, and then people exiting a psychiatric center, one of the 4 designated state hospitals. But for the purposes of this presentation, you should know that for youth exiting foster care, we do have these prevention projects set up in each of the 4 areas. Life Skills handles that area, Bowling Green and Barren River Ad. Adonta covers Somerset and Lake Cumberland. New Vista covers Lexington and the Bluegrass Area Development District. And then in Louisville, we have 7 counties. One of the challenges we have with this project is getting referrals through the protection and permanency, because that's where they have to come from. And then the last initiative I want to talk about is the Family Unification Program vouchers. Here too, folks are referred through DCBS protection and permanency. And this is for families for whom the lack of adequate housing is a primary factor in a child welfare case, right? And then the second population is for that transition aged youth, at least 18 years, not more than 24, who have left foster care or will leave foster care within a prescripted time frame. There have been some recent improvements in state law. In 2023, this most recent legislative session, we were able to help advocate for House Bill 21. And part of that bill, it was basically a streamlining of ID, the ID process for people experiencing homelessness to obtain a state-issued ID. One piece of that specific to this population was that it will allow unaccompanied 16 and 17-year-olds to obtain a state-issued ID without parental consent. These are folks who meet the McKinney-Vento education definition. And the last piece too is that it will be $5 as opposed to, right now they can't get it at all, and those above 18 have to pay $10. We expect this will be effective at the end of June. And then in 2021, Senate Bill 21 allowed for unaccompanied 16 and 17-year-olds to obtain mental health counseling from a qualified mental health professional, again, without parental consent. And when we are talking about 16 and 17-year-olds who are unaccompanied, these are folks who do not have a relationship with their parents. They're on their own. So it's not a matter of like bypassing parental rights. That's not what we're trying to do here. And then in 2019, House Bill 378 allowed for free birth certificates for youth under 25. So both like children, school-age kids, teenagers, and then that transition-aged youth population. It also established alternative coursework requirements for homeless youth so that they could meet high school graduation. Because with homelessness comes a lot of moving places and moving school districts. So how can Medicaid help? So there's some current efforts, and one is the one that has been in place for almost 10 years now, but is still really, really important, and that is Medicaid expansion, keeping parents and kids covered. And because of different states have expanded Medicaid, different states have not, we now have a pretty good source for like actual real research on connections between medical coverage and housing stability. And so I just picked a few that have come out within the last 3-4 years around the connections between state level Medicaid expansion and eviction rates. States that expanded Medicaid, their evictions, it was associated with a decrease in evictions. Same deal with the second study, can Medicaid prevent housing evictions? And then on the flip side of it, do evictions negatively impact Medicaid enrollment and utilization? And shockingly, the answer is yes. So we do think that the existence of Medicaid expanded for this income level has been really key, and will continue to be key to support this population. Obviously with K-CHIP, you have a higher income eligibility for kids. It's great. We do like the one dedicated managed care organization for fostered unaccompanied youth. That makes a lot of sense to us. I don't know if others on this call agree or disagree, but just having an MCO that's dedicated to this population, I think is really good. And then lastly, the Department for Medicaid Services incorporating social determinants of health requirements and MCO contracting practices. This has been a conversation that's been happening for a long time. We support whatever DMS can do in terms of their contracting practices that help address this housing instability issue. Some of the strategies on the right-hand side, as I said, this is a conversation that's been happening. We would recommend strengthening the contracting process, coming up with specific deliverables and implementation that would reduce barriers and provide tenancy supports. And then also, MCOs are located in a lot of places in Kentucky where we do have housing providers. It makes sense, rather than reinventing the wheel, to partner with existing homeless and housing providers where it's possible. MCOs underwriting housing using non-Medicaid funds. So we know Medicaid can't do bricks and mortar housing construction, but we have seen in other states, our neighbors in Ohio and Humana have really invested, or CareSource, have really invested in supportive housing across the river. And then lastly, I'm going to use an example from a different subpopulation, but the current 1115 waiver amendment application that's been being submitted to CMS, and the public comment period just closed last week for individuals with serious mental illness. And then what I understand will be a future 1915I application for supportive housing. I think what we have learned over the past few years is CMS is very interested in addressing housing as a social determinant of health, and exploring the connections that Medicaid can support housing stability. And so whatever DMS can do, working with stakeholders like those of you on this TAC, I think would be interesting to explore. So that's me. That is some of us at the Capitol this winter. And this is how to get up with me. And that is the end of the presentation. I'm happy to take any questions.
Thank you very much, Adrian. That was very helpful and enlightening. And it's exciting to see that there have been some discussions about the link between healthcare and social determinants of health and homelessness, and how they can affect each other. So my question to you is that we know our neighbors in Ohio are doing something with Humana and CareSource there. And this is a question to you and to our colleagues, our MCO colleagues that are here in this meeting, are there any discussions currently in the state of Kentucky with any providers about housing support?
This is Stuart on with WellCare. I figure I might as well just jump in. All of the MCOs in Kentucky have support already, and continue to expand. Like WellCare, for example, we were a founding partner with Hotel Inc. going back to 2016. Another one I think called Welcome House. So it's something that we're already doing in Kentucky, but continuing to grow it. And huge kudos to Adrian. Getting bills passed and multiple bills passed, getting any bill passed, that huge props for that. But I think another bill that was actually passed last year that will help is the community health workers. that will be a Medicaid covered benefit where providers, because they basically help individuals navigate the healthcare system and address social determinants of health. And so providers will be able to hire, and DMS is going to go live on 7/1. Providers will be able to hire community health workers, and MCOs will pay for community health worker services. So that'll be a covered benefit, and they help address homelessness, as well. So I think that's going to be really pivotal as well. But we and all the MCOs I know have partners with homelessness and support homelessness, I guess community agencies or whatever.
Yeah, I
But
would echo that. House Bill 525 from the last session was something that we supported and worked on as well. And it's been really great to see the growth of the community health worker infrastructure in Kentucky. And I think we can, making it a Medicaid billable service will be huge. And as far as the partnership with WellCare and Hotel Inc. is like, when we, I didn't talk about this on this presentation specifically, but when we were advocating for Senate Joint Resolution 72 from last session, it was, and that has kind of prompted the current 1115 waiver amendment application. It is because WellCare and Hotel Inc. partnered to do medical respite / recuperative care again for this SMI population. And it's one of those things where it is, we believe it addresses Medicaid's triple aim. And it also, from our perspective, we're not discharging people from hospitals onto the streets. So.
Thank you. Would any of the other MCOs like to comment about? I'm excited because as a provider, I certainly had no idea that the MCOs had already started working on addressing some of these things. So it's actually pretty exciting for me to learn this. And I suspect that other providers would also like to hear this information.
We've had that reaction and legislators as well. Last year, each MCO testified, and legislators were surprised. They had no idea that MCOs do that. But yeah, we definitely, and we all do.
I mean, in my ideal world, if I signed Stewart's paycheck, which I do not, I would love to see some significant like underwriting of construction, again, not using Medicaid funds, using non-federal funds. But if there's a way to leverage MCO dollars into real construction for affordable housing, using the existing low-income housing tax credit process, partnering with developers, that sort of thing. That is really that is what we would like to see, is leveraging some of the non-Medicaid money for development. Because again, I always come back to it's kind of like a game of musical chairs, and I'm not the first one who came up with this analogy, but everybody's familiar with the concept of musical chairs. We have 10 chairs, but we have 11 people. Like, one person is always going to lose out. And that is a little bit what the housing market is like. Like, someone is always going to lose out. And so whatever we can do to address the supply for our extremely low income Kentuckians, because the housing that they need is not getting built by the private market.
Thank you. Any other comments or questions?
Yeah, this is Jeff Hadley. I'm with Humana. Just wanted to follow up Adrian's comment, we're actually, we are doing that with Humana. Had reviewed, I think, 4 different or low-income housing developers that we have partnered with for the low-income housing tax credits. And we've actually zoned in on one of those so that we can increase that partnership, and are looking at activities that we can partner with those actually those facilities that they've developed to bring additional resources and collaborations, say maybe a resource fair or an ongoing project where we're continuing to collaborate and bring additional resources to the individuals that are being housed in those developments. So that is something that Humana is already working on.
Okay, thank you. Anyone else?
Hi, this is Stuart Cox with Anthem.
Yes.
We definitely have a housing flex fund that we utilize at Anthem for our SDOH needs and support there. We don't have any direct development, major development programs, but rest assured there's daily work between case management, our empowerment team, those who do have member engagement to assess, look for the results from those assessments, and to apply interventions related to SDOH. In addition to the housing, of course, the food insecurities and just, the transportation needs. So sometimes they go together hand in hand, and that's something important, based on geography and location. They can be interrelated. Access to food, based on the location they live. Not only can they afford that, but the access to the food as well as the transportation components too. So we have a robust program where we're engaging and applying value-added benefits as appropriate to support that.
That's wonderful. You guys are doing some great work out there, and we just don't know it. So thank you for sharing this. Anything else for Adrian? Adrian, thank you so much for educating us and for working hard to advocate for children and families and for their housing needs.
Thank you so much. I do appreciate the opportunity to talk to new folks, and I am relatively new to the TAC mechanism, but I find it one of the more functional pieces of making sure that concerns are heard and addressed and stuff like that. So yeah, I'm always happy to help out with another TAC.
I will also tell you that as a provider at one of the big university systems, we are now in the next year will be held accountable for documenting that we address, that we investigate and address social determinants of health for the patients that we see. So I feel like we've been doing that, but we have to prove we've been doing that and that we're addressing it. So I think there are lots of opportunities for additional partnerships when it comes to finding folks that need resources, and then how do we connect them to the appropriate resources. Stuart, I think you were going to say something.
Yeah, I'll throw something else in.
Okay.
And you may be aware, just in case any aren't, there are ICD-10 codes, diagnosis codes to put on a claim to address social determinants of health. I think not all providers are aware of that. I presume it's just voluntary, but that's really helpful for MCOs. That helps us identify. It's one way to help us identify the social determinants of health needs of our members.
Yes, please use those new ICD-10 codes, because I part of our work around medical respite, recuperative care, and also kind of filling out the picture of who is experiencing homelessness. I worked with Tom Walton at the University of Louisville and the Office of Health Data Analytics to do a data request from 2019, which was like the first year that those codes were used. And it was fascinating because people should not be discharged into homelessness for like a number of reasons. A humane one for one, but also because it's against CMS practice, and also you get dinged with hospital readmissions, and it's a mess for everybody. But again, it was having that new mechanism for claims data was really, really helpful in understanding the problem.
Hey, Adrian. Well, I'm Bethany Fomby, by the way. I
Hey,
know Stuart.
Bethany.
Hey, I know Stuart talked a second ago. I jumped on a little late about our empowerment team and some of the stuff we have. But I remember meeting with Tom over that, and I mean that was very interesting conversations. And that actually, I was really excited about us getting to do our housing flex fund and stuff. But again, if it's not identified and if people are, just thrown out on the streets after, it gets really tricky because that's a hard population to reach anyway, even when we do have the resources to help.
Yeah. No, if you don't know Tom Walton, I have so much respect for him. I think everyone should know Tom Walton.
Yes,
But
he is
he really
amazing.
drove that process.
All right. Thank you so much. Anyone else have any comments or questions? I think it's really helpful, again, as a provider to hear, hey, if you use these ICD-9 codes, this is going to flag this patient to their MCO so that they know there's an issue there. And I am spoiled and fortunate in that I have a social worker in my clinic. And if I see someone that has food insecurity or a problem with housing, we also have a medical legal partnership. And so I have all these resources that I can just run down the hall or get on the computer and say, hey, can you come to room so-and-so? I feel like this family needs some help. But to get that word out to providers in other parts of the state and in other offices where they're seeing these folks and they don't have that social worker, that resource in their clinic to help them find resources for that family, I think is really important information to get out to providers. So thank you all so much for that. And I'm just I think Stuart Cox has put in the chat. We must also acknowledge that the new HEDIS SNSE measure that utilizes LOINC, HCPS, and SNOMED codes is now in place.
Yeah. Hi, Donna. This is Stuart again. I just thought it might be worthwhile just to share that this year there was the new introduction of the SNSE measure. It's an electronic coding measure, so that pretty much replaces the codes of the Z codes previously, and it's very complicated. All the MCOs are working on, I'm sure right now, what that means to communicate with providers. But there is a new coding system, and essentially there's the three elements. There's the assessment, so utilizing different tools, you code based on the assessments, and then of course the result of that. And if a member or patient is a positive for a need, whether related to housing, food, or transportation, then there's also a intervention code for referrals and for a solution to that. So more to come on that, but we're all working on that, on how to best integrate that in our programs, and that'll be even more relative going forward.
Just throwing this out to other members of the TAC, would it be helpful to have a brief presentation at our next meeting from the MCOs on resources available for patients and families.
I'd love to have resources we could provide for parents on things like that that we could share with them. I think that'd be very helpful.
Okay. So perhaps when we plan for next, for July's agenda, we may be able to request that data from our MCOs about, tell us what you are doing and what information do we need to know about how to access those resources for patients and families. If you guys would be willing to share that in a formal way.
I can send that out as a formal request to the MCOs to have a presentation ready. Do you want all 6 MCOs to present next meeting, or do you want to break them up 3 and 3? How would you like to?
I'll leave it up for the discussion. Certainly when we've done, the 5 to 7 minute presentations, we can certainly do all of them. But if you all feel like it's going to take you longer to give us that information, then perhaps we should split them over the next couple of meetings. What do you all think?
I know with Anthem, it kind of depends on really like what you'd want and how much you'd want us to share, where we have a full SDOH team, the empowerment team, and then our other teams address SDOH needs as well. And there's different factors. I do have a very short PowerPoint if you wanted that. We can kind of do what works for you all for as far as Anthem's perspective.
Yeah, I'm thinking like 5 minutes. 5 minutes is probably doable for each of us.
Okay, we can fit all 6 in then, and when I send the email, I'll just make the request that everyone stays within the 5 to 7 minute time frame, so we can get everybody situated. Thank you.
Thank you. And from the members of the TAC, is this something that you want on homelessness, or do you want them to talk more broadly about social determinants of health? Anything, Courtney, any thoughts?
Sorry, my technology is really messed up. I'm having trouble.
I felt like you were trying to say something, but I was just.
Can you hear me now?
Mhm.
Okay. I feel like if it's combined, I don't know if those are 2 different presentations, possibly. I don't know what all. I guess I feel like we've heard some about the other social determinants of health in other presentations before, but because there's a lot of overlap in those areas, and other things we've been talking about. But I guess I'm kind of open to whatever everyone else thinks. I don't have I love things that we can pass on to families directly, but also to other providers. And for instance, in the clinic where I work, where we're giving resources out all the time to hundreds of people that call in every week. So what do you guys think? Does anyone else have a strong opinion about just homelessness or all the areas?
I was going to say you got food insecurity as well, which is very related, very intertwined.
Yeah, and housing and food are the top 2 needs across the state of Kentucky.
So maybe just focusing on those 2. Yeah.
That'd be good.
Okay. All right. Thank you all. Thank you all for this discussion and kind of helping us get an idea of what's available, but not only that, but giving us ideas for, hey, we would like to know more about this. And again, thank you, Adrienne, for coming and talking with us. If there's nothing else on this, I would like to move to, and actually we've sort of naturally moved into the discussion of future meeting topics.
Donna, just to make sure I have the request correct, we would like a 5 to 7 minute presentation from each MCO on their resources that they provide for social determinants and homelessness, correct?
Homelessness and food insecurity. I think we
Okay.
decided to focus on those two.
Okay, thank you. I just want to make sure I get the requests to the MCOs that exactly what you guys want to see. Thank you.
Okay. Is that correct? Other members of the TAC? Okay. Okay. Any other, I feel like that's going to be a pretty robust discussion again next time. Anything else that anyone would like to bring up in terms of future meeting topics? So I feel like that where we're moving is that in July, we will have the MCOs give us reports on their resources for homelessness and food insecurity. And then perhaps at the next meeting, we can talk about what we would like to discuss in September.
We have that little, I guess, that list of things we had kind of generated that
Mhm.
are on the agenda there, future topics. Maybe we can just decide what a good segue is after we hear about these things next time.
Okay. Yeah. Okay. And then do we have any recommendations based on this discussion that we need to make to the MAC? Do we want to say something to the MAC about we recognize that poverty and homelessness is a huge impact on children and families and their, and their well-being. And I'm not sure what recommendation we would make, like encourage the, Medicaid and the MCOs to continue to develop resources to address this issue.
I mean, I think that sounds reasonable. It seems like Adrian's take-home point was really that it's a housing, issue, but that's not really Medicaid's, money to put toward that. So I don't know what other nudges can be given, but it just seems like that's the take-home point.
So I am not a member of the Children's Health TAC, so take what I'm about to say with a grain of salt. But I do think I think at this point, if you can hear from the MCOs about what they are doing to address social determinants of health, next meeting, maybe a future meeting, but maybe at that point, you will have some sort of specific recommendation for the MAC. What would be really great to see at some point, I just think it might be a little bit premature, is recommending that DMS explore some sort of waiver for tenancy supports through the Medicaid, through different Medicaid authorities. But also I recognize that DMS has their hands full right now with the current application and process. So that's why I'm saying it might be a little bit premature.
So perhaps no recommendations to the MAC at this point, but after maybe next meeting, we can identify some recommendations we can make once we see where, and maybe the MCOs are covering it all or covering it the way that we feel like they can best do it. But maybe just waiting on recommendations till that meeting.
So hi, this is Danita. I'm the Equity and Determinants of Health Branch Manager in Quality and Population Health. We are currently working with the Medicaid Collaborative Innovation, and we are in the 2023 cohort where we are currently focusing on the social determinants of health efforts with the MCOs. So we are currently working on some efforts to address those. And we do have some specific guidance written into the quality strategy already. So those are some things that we are currently working on in regards to those initiatives. So at some point if the TAC is interested in us providing further details on what we are doing, we would be happy to present that for you all.
Sure, that would be very helpful. And I feel like that if you feel like that fits nicely with what the MCOs will be discussing next time, we can do that at the next meeting. Or if you feel like that lends itself to a separate discussion, we could certainly put that on the agenda for September's meeting.
Donna, you can even ask DMS to present. They have a canned presentation that they've done at other TACs on this effort.
Okay. Perfect.
I was going to throw out as a random note, because Adrian talking about DMS having their hands full reminded me that there was a bill, just a note that there was legislation passed in the session to create a demonstration waiver, which could take a couple years for children as an alternative to juvenile justice detention, that instead they would get Medicaid. They'd be eligible for Medicaid care. And that's, we already have that for basically adults and substance use treatment. But just as an FYI, that DMS will have to pursue a demonstration waiver for that as well, which will help juveniles. So I thought might as well throw that out there.
Does sound like they have a lot of things that they're addressing right now. Well, thank you guys. This has been a very helpful discussion, and I think we are moving toward what we would like to hear at the next meeting. To the TAC members, do you feel like having DMS also present next time is going to be too many presentations, or do you feel like that's going to lend itself nicely to?
How long would that presentation take? Would it be like 10, 15 minutes, or how long would that be?
Danita, did you want to comment?
I think if we're looking at the presentation, if that canned presentation, is that the one that you're looking at that Deputy Commissioner usually gives? Is that the one that you were referencing?
Yes.
Okay. I would want to check with her before we committed to that one.
Okay.
And maybe put that one to the next TAC and just let the MCOs.
Okay.
The upcoming one.
Okay. Thank you. All right. Any other comments, questions? Erin, do you want to tell us when the next MAC is?
The next MAC meeting is the 25th of May.
And is that a Thursday?
Yes, ma'am.
Okay. And I feel like we've discussed this before. I feel like several of the members are committed to doing things on Thursdays. Are there any TAC members that would be willing to represent us at the MAC that aren't tied up with commitments?
Remind me the time of the meeting, Erin?
It is from 10 to 12:30.
I'm not able to do that.
I can probably attend. Donna, I've been to those. It's been quite a while before I was the representative for this TAC. is it just kind of being there and letting them know that we don't have any recommendations for the current meeting and then listening in to see what other TACs are presenting? Is that the expectation?
Mhm. Yes.
Okay.
Yes, ma'am, Alicia, and then you would just give just a brief overview. You guys met, you had a presentation, just kind of a very brief, this is what we've been discussing. And then if you had recommendations, present your recommendations. And then listen in, like you said, see what is going on in all the other TACs. So it's just a very brief overview. It doesn't have to be anything lengthy.
Yeah, I think I should be available on the 25th for this one. If you'd like me to attend, Donna, I can.
Yes, thank you, Alicia.
Erin, what's the best way to make sure that I get an invite to that meeting?
I can forward you the calendar invite, so you'll have them
Okay.
on your calendar for the rest of the year.
That'd be great. Thank you so much.
You're welcome.
All right. Thank you, Alicia. Our next meeting is July the 12th from 2 to 4. We have talked about what our agenda will be. So if the TAC members want to stay on for a few minutes, we can go ahead and finalize the agenda so I can get that to Erin. And we appreciate everyone who was here today and participated. And I want to, again, particularly thank Adrienne for her presentation and for all of her hard work. And I'm excited to hear from the MCOs. Again, as a provider, I don't think we know what we don't know sometimes about what's going on out there. So this is very helpful. With that, can someone move to adjourn?
I move to adjourn.
In a second?
I second.
And all in favor? Okay. Thank you all. If the TAC members and Erin would stay on, we can hammer out this agenda and get that to Erin, and we'll be ready for next time. Thank you all.
Thank you all. Have a good rest of the day.
You too.
Have a good day.
Ah, the gift of time.
Give me just a second. Let me stop recording and all that fun stuff.